Welcome to Pregnancy 101. Hey, it's Morgan with Passable Parent, where we help you improve developmental outcomes for your child and find the joy in parenting. I've been a pediatric nurse for the past 10 years, specializing in early childhood development, and I'm also a new mom. Before we get started, don't forget to like and subscribe and check out all my other videos on all things pregnancy, postpartum, early childhood development, and taking care of your baby. What is Pregnancy 101? Let's talk about all the ways you can optimize having a healthy pregnancy and what to expect when you're pregnant. First, let's talk about some early signs of pregnancy that some women might start to notice 1 to 2 weeks after their missed period. First, you might be feeling a little bit of breast tenderness. You also might be increasingly tired. You might have some bloating. You also might experience some nausea, some morning sickness, some migraines, some frequent urination, and even some moodiness. This is all due to all the hormonal and chemical changes happening in your body. So what can you do to help make this pregnancy a healthy one and to feel the best that you can despite some of these unpleasant symptoms? The first thing we're going to talk about is diet. Sadly, for those of us that are foodies, the saying eating for two is just not true. Sadly, this is not based in any scientific evidence, and increased calories that you need for pregnancy are very, very specific, and they relate to your body weight pre-pregnancy. According to the American College of Obstetrics and Gynecology, an average weight woman pre-pregnancy only needs about 300 to 450 extra calories a day, and this doesn't start until the second trimester. As you can see, I attached an ideal weight gain in pregnancy chart. If your pre-pregnancy weight starts out as average, which means you have a BMI between 18.5 to 24.9, the recommended total weight gain for you during your pregnancy is 25 to 35 pounds. Much of this occurs in the second and third trimester, and it should be about an average of 0.8 to 1 pound a week. If you're an average weight woman, the weight breakdown per trimester basically breaks into the first trimester is no more than 2 to 4 pounds, the second is 12 to 14 pounds, and the third is 8 to 10 pounds. Weight can be a stressful topic for many of us. Try not to worry about it too much and give yourself some grace. Ideally, these are optimal metrics to follow, but everybody is different. Your body is doing a miraculous thing. If you have any concerns about your weight or the proper weight you should be gaining during pregnancy, please consult your trusted medical provider to get their opinion on what goals you should be hitting when it comes to your weight gain and what target range you need to be in. So where does all this weight go that you gain in pregnancy? As you can see in this chart, your baby is about 6 to 8 pounds of the weight gain. Your placenta, which is responsible for the nutrients for your baby, is about 1 to 2 pounds. The amniotic fluid surrounding your baby in the protective bubble of your belly is about 2 to 3 pounds of weight. Your uterus actually enlarges and weighs about 1 to 2 pounds in pregnancy. The maternal breast tissue also increases, and that weighs about 1 to 2 pounds. Some women with larger chests can actually see an increase of up to 3 pounds in breast tissue. Maternal blood volume during pregnancy attributes towards 3 to 4 pounds of pregnancy weight gain. Fluids in maternal tissue is another 3 to 4 pounds of the pregnancy weight gain. And maternal fat stores can be about 8 to 10 pounds in an average sized woman pre-pregnancy. If you haven't already been taking a prenatal vitamin prior to your pregnancy, please consult your doctor and find out which prenatal vitamin is right for you. You should be getting vitamin D, folic acid, iron, calcium, and these could be from your prenatal vitamins and also from your diet. If you're looking for some great books to read and you want some information other than from this YouTube channel, The Passable Parent, then you should check out the book What to Expect When You're Expecting. Another great book, which I'll have both of them linked below, is Your Pregnancy and Childbirth. And this is a book from the American College of Obstetrics and Gynecology. Your OBGYN also might have free copies of either one of these books. You just have to ask. So in terms of diet, what food should you be eating? American College of Obstetrics and Gynecology warns that certain foods should be avoided during pregnancy because they may pose a risk to your baby. These include unpasteurized fruit juices and veggie juices, and kombucha, seafood high in mercury, shark, swordfish, barramundi, raw undercooked seafood, meat, eggs, Sorry, my fellow sushi lovers, this one is targeted right at us. Soft cheeses like brie, deli meats, unless you cook to steaming. Not sure how that tastes, as I don't know anyone who has attempted that. The reason they recommend against this is due to infection risk from Listeria or Salmonella. It can affect neurological development of your baby negatively. Many women have eaten some of these foods during pregnancy, and it's really all about your personal risk tolerance and talking with your trusted healthcare provider about what foods they feel you should be avoiding during pregnancy and deciding what is right for you. The number one thing is to have a balanced diet rich in fruits, veggies, proteins, and whole grains. You also want to make sure you keep your fiber up, as constipation can be a really unpleasant side effect of pregnancy. All right, all my coffee lovers out there. So, can you be drinking coffee during pregnancy? American College of Obstetrics and Gynecology says that less than 200 milligrams a day of coffee does not cause miscarriage or preterm birth. That's the amount of 1 cup of coffee, but please check labels because no 2 cups of coffee have the same caffeine content. The negatives associated with caffeine intake include increased nausea, increased lightheadedness, decreased sleep, increased urination, which can lead to dehydration. So, can you exercise during pregnancy? It's recommended to exercise at least 30 minutes a day, 5 times a week during pregnancy. Ask your doctor about pregnancy-safe exercises for you. Things you should not do during pregnancy. Number 1, smoking. Smoking can lead to stillbirth, SIDS, which is sudden infant death syndrome, vaginal bleeding, and low birth weight. Number 2, alcohol. There is no known safe amount of alcohol that you should be consuming during pregnancy. Consuming alcohol during pregnancy impacts your baby's brain and their growth and development. Many of us have heard of fetal alcohol syndrome. This is a really horrible syndrome that can occur due to mom's alcohol consumption during pregnancy. The third is marijuana. There is so much new research out there showing that babies whose mothers smoked marijuana while pregnant has led to learning deficits. Number 4, no illegal drugs or substances should be used during pregnancy. If you are struggling to quit any of these 4 items, please know that there is help out there for you. There is the Substance Abuse and Mental Health Hotline. There also is the National Quit Hotline. That's 1-800-QUIT-NOW. So, what are some other things that you should be avoiding during pregnancy? You should not be cleaning cat litter. There is a disease called toxoplasmosis, and this is found in your cat's stool or poop. Any pregnant woman does not want to contract toxoplasmosis while pregnant because it can lead to developmental deficits in your baby. Make sure that you talk to your trusted healthcare provider or OBGYN about any prescription drugs that you are already taking prior to pregnancy. You want to make sure that you're taking pregnancy-safe prescription drugs, and your OBGYN or healthcare provider will be the best person to talk to about this. Next, I'm going to put up a chart of some safe versus not safe over-the-counter drugs. In this chart, you can see that what's safe in pregnancy is Tylenol, acetaminophen, Maalox or Tums, Miralax, Metamucil, and Robitussin. Over-the-counter prescription drugs that you want to avoid during pregnancy are NSAIDs, which are ibuprofen, Motrin, Advil, aspirin. Unless they're prescribed by your doctor, they can hurt your baby's kidneys. And Pepto-Bismol. I always recommend, if you can, for any caregivers or future parents to take some courses at your local hospital, birthing center, or even websites such as Eventbrite host some online courses. Some courses you really want to take before having a baby are infant CPR, maybe a course on labor and delivery, what to expect. You cannot educate yourself enough when it comes to caring for a child. So I strongly encourage you to look for local courses or to look online and see if there's any online courses offered. Many of them are free to you at no charge. So please, I can't stress enough, look for some of those courses. You cannot be educated enough. So with a few changes to your lifestyle or a few modifications, you can decrease the potential negative risks to your baby and increase the chances of having a healthy, happy pregnancy. I hope this video was helpful and informative, and I hope you learned a little bit about pregnancy and some of the guidelines you should follow. I wish you the best of luck along your pregnancy journey, and please check out some of my other videos. I have videos on all things pregnancy, postpartum, and early childhood development. Don't forget to like and subscribe. Hope to see you next time.